Yeah, go 1, 2, 3.
That's right.
All right, Commissioners, we will go ahead and call the meeting for the Community Relations Commission, September 11th, 2025 to order. Can we start with a roll call?
Commissioner Barrero, absent. Commissioner Bravo, Commissioner Brown,
Present.
Commissioner Crudup,
Present.
Commissioner Garwick, absent. Commissioner Call,
Here.
Commissioner Linval, absent. Commissioner Martin, absent. Commissioner McDowell,
Present.
Commissioner Pakela.
Thank you. So the first thing on our agenda is acceptance of the Journal of Proceedings for the Community Relations Commission held on August 14th, 2025. You all had a chance to review. I will entertain a motion.
I motion.
A motion, do we have a second?
Second.
A motion and a second. Any discussion related to the journal? All in favor of approving the journal? Aye.
Aye.
Any opposed? The journal is approved. We have no public speakers tonight, so we'll move right into our conversation. We have the Jason Holcomb from the Winnebago County Community Mental Health Board to give us an update on the work that's happening around mental health in our community.
Thank you, Eric. I was in the elevator coming up to the meeting, and some of the maintenance staff was in there, and they asked me how long the meeting was going to be, and I said, well, I think it depends how many questions I get asked. So just letting you know your night is in your own control. But ask as many as you want. My name is Jason Holcomb, Director of Community Impact for Region 1 Planning Council, and part of what my kind of programming is focused on is community health, regional data, public engagement, and social innovation. But we also have an agreement with the Winnebago County Mental Health Board through an intergovernmental agreement to provide their administrative services. So they are the public body that manages and authorizes the funding from the half-cent sales tax for mental health in Winnebago County, and we at Region 1 provide for them their strategic planning, assist them with their competitive grant-making process, their program evaluations, some of the system coordination functions that I'll talk about a little bit tonight, and community engagement functions like coming and presenting to a committee like yours. So thank you for having me here tonight. I don't want to be overly bureaucratic and get into the weeds of how the sausage gets made, but I think it's important because this is a public fund that gives out a lot of money to local mental health resources, and to not talk about how those decisions are, what the foundation of those decisions are, I think would be short-sighted. So I do want to talk a little bit about the strategic planning process and kind of the board's mission. The board, as it formed, and even for those advocates that campaigned prior to the formation of the board, rooted in multiple committees that had done research on mental health going back a decade, had identified the need for a coordinated system of care and really looked at a research-based model called the community support system model that's based out of deinstitutionalization research from kind of the mid-1900s into really the kind of like 70s and 80s. Some of this research was coming more on board out of the deinstitutionalization movement, and trying to identify what is the array of services that a person with serious mental illness needs to live and recover in their community. What does that look like? And so that's what you see in this wheel with that kind of those different spokes of the wheel, so to speak, are those services. And what connects those for the individual is case management, and what connects that for the community is really a coordinating body. And so the Mental Health Board, to some degree, is a coordinating body as it relates at least to this local funding here in Winnebago County. And then if you want to just see a little more closely what are the actual service areas in that, there are some of the really clinically based services that you might think of when you're talking or thinking about mental health treatment, like diagnostic evaluation, psychiatric services. But there's other stuff too, because people with mental illness or substance use disorders sometimes don't function in a independent living environment, and so they might need supported housing, whether that's permanent supported housing or transitional supported housing. Income support, sometimes that means helping get entitlements like disability benefits for somebody that is at that time not able to be in the workforce due to their mental illness or substance use disorder. Well, mental illness. I don't think Social Security actually provides benefits for substance use disorders. But and crisis response services, like what do you do in the moment of crisis? Who do you call? Who responds, and where do you go? So those are just a few examples, but you see the outline of all of those services. And again, this is rooted in research, so there's, I think, somewhere we've got posted like a 25-page primer that really breaks down each element, each service area even more. And then, so we take that model as a starting point, and then every 3 years, by state statute, required to do a strategic plan. So before any funding went out, we surveyed all of the organizations that provide mental health services and substance use services in Winnebago County to the extent that we could. We didn't capture all the private practice locations just because we don't have a database that includes every single private practice, but most of your nonprofit, public providers, and several private practitioners. And then we updated that 3 years later. And so what that looks like in terms of the organizations that responded, I believe it was about 50 or just over 50 that completed it in each cycle. And you see kind of the mix of services as it relates to the community support system. Not surprisingly, those clinical elements of mental health treatment are at the highest percentages of organizations that provide those services. And crisis response services, housing are kind of on the lower end because those are usually, well, crisis response services usually involved a more select group like your first responders and a few community mental health providers that are contracted through the state to go out on crisis calls. And housing is another one that, while it can be challenging to operate permanent supported housing for smaller organizations, you have to have a lot of capacity to do that. And then another view is, so where do these organizations get their funding? And this was only after the second year of mental health grants here in Winnebago County, and you see that already that was one of the highest sources of funding that organizations locally were receiving. Doesn't mean it was the most amount of funding they were getting, but a lot of organizations were receiving that funding. Maybe a little skewed by the fact that we sent it out to organizations getting the funding as well, but we see that that's, almost on par now with like organizations that are getting state grants, and we see a little bit less on fee-for-service, probably again because it's nonprofits and government and only select private practices. A lot of the private practices operate solely on fee-for-service revenue and not grants or public funding. This is a cool one because I think when we do community needs assessments really well, and we do them routinely, they can become an evaluation tool as well. So we were able to compare some of the data we had from the first one that we did before any money went out, and then the second one that was right after the second year of programming. And one of the things we looked at, so apples to apples, it's only for the 24 organizations that did it both times. So it's not based on like, oh, well, it's not the same organizations. And we asked, what percentage of the organizations are providing services for either mental health, just mental health in one of those 6 components of the community support system, just substance use, or are they doing it for both? And I think the cool thing that we see here is that purple represents both, and you see a larger proportion of both in every one of those component areas in the community support system. And I think that's particularly important because that's how mental health and substance use disorders, when they're co-occurring, should be treated. But a lot of the diagnostic systems and funders of the past separated those and made you choose primary diagnosis, and the funding sources were connected to primary. Even the state only just this last year merged their Department of Mental Health and Substance Use under the Division of Human Services. So they're starting to integrate that more now, and so the funding will probably integrate that better. But here in Winnebago County, the Mental Health Board not only allowed for that, but encouraged that. And so I think that's one thing we can say, that we see the evidence of change there, that there's more organizations that are treating co-occurring and not separating substance use and mental health as separate treatment. And then another one that we were able to compare over time for the same 24 organizations was how those services, like where are they being provided? Are they being provided just in an office setting? Are they being provided out in the community, like for like mobile response, or are they being done both? And here we see once again an increase in each one of those service areas for either mobile services being provided or both mobile and office. So the addition of mobile services in some way across each of those items. For a lot of funding, even Medicaid funding, it's fee-for-service, and fee-for-service doesn't cover transportation costs. So sometimes the model is based on really having productivity standards, where on an 8-hour shift you might have to have 6 hours of billable services. So providing mobile services is not an option. With the local funding, that allowed for a lot of organizations to be able to go out into the community to engage, find clients, do assessments outside of an office setting, or meet somebody at a place where they're already receiving another service. And so I think that's another really great benefit of having local funding, is to be able to see those services get more throughout the community and increase access. But again, that's just one like kind of evaluation element that we used out of the community needs assessment, but it was also to assess current needs. And the other part of that is, so we want the provider perspective, certainly, but we also want the public perspective. We want the people that are using the services. So we did a public participation survey, and we wanted to really disaggregate and to kind of identify the perspective that each respondent is representing. When I'm doing surveys at home, I'm on my phone at home, maybe it comes across, but I'm not always asked to identify my perspective. So sometimes I might be wearing my professional hat and my, personal hat, and I've got a family member that hat at the same time, and so my perspective can become multiple things. We wanted to really target, pick what you're representing here, because are you giving us the perspective of an agency administrator, direct service staff, frontline staff, an individual living with mental illness, a family member of somebody living with mental illness, or maybe you're just a general community member that you've gone out and you voted and you've seen this tax on the ballot and you want to know what's going on with it, or you want to still have some input into it. In total, we had 258 completed responses, so that's what you'll see here for our results. And for the lived experience, we have it broken up into, the pink color is those that represent somebody living with mental illness or substance use disorder, And then the purple represents a family member of somebody that's living with a mental illness or substance use disorder. In general, the number one response when we asked in the past 12 months, which of the following services did you or someone in your household need, but you couldn't get it? And the number one response is psychiatric help or counseling, which is challenging because that was also the number one service that organizations provided. So you see how big that need is when that's the number one service available, and still that's the number one service that people are having a hard time accessing. The second answer is a little different based on perspective. So for those living with mental illness, they said peer support, finding somebody or a group that has people with similar experiences that I can talk to. Family members didn't necessarily see that as important as the person living with. I think that's an important nuance to understand. And family members, not surprisingly, I think the second highest there was income assistance with income or bills. You can imagine family members that maybe are supporting somebody that's struggling, and then you're taking on some of that financial impact and looking for that support. The other one I want to bookmark for when we get to a later slide is it's not the highest and it's not the lowest, but it's to the lower end, or it's kind of in the middle, is finding information about services you need. So just bookmark that one. We'll come back to that idea. And then the second question is, what do you think would have helped? Like, what would have helped you get those services? And top two answers: more providers, less wait times. Across the board, whether you're living with or a family member, more providers, less wait times. Then we get into that mental health worker perspective, and here we have two types of workers. We've got the blue worker, represented there with the blue color. That's the frontline staff doing the day-to-day services. And then you have purple, which is that administrator, top-level administrator. Excuse me. Here we see both perspectives represented. Here's the question: what is the easiest service or the easiest function for clients to access? And here the highest answer is finding information about services for both. Both agreed with that. So again, like, people living with it, navigating the system, found it relatively easy, wasn't the hardest thing for them. Workers are saying finding information is the easiest thing, and that one of the harder things is actually getting psychiatric help or counseling. Again, even though a lot of them are providing that service, they're also acknowledging that that's one of the harder things to find. And when asked, what do you think could increase access? Top two answers, once again, across the board from all perspectives: more providers, less wait times. So we see that from everyone working in the system and everyone using the system, that's the main issue with access right now. And then finally, this is the general community member perspective. And here, this was just more like, okay, so what do you want to learn about? What do you want to know about? Because you're not currently using the system and you're not working at one of these organizations. What would you like to know about? And here, the number one answer was finding information about services. So we think that's interesting because the people using the system aren't necessarily, that's not their top issue, and workers, that's not their top issue, but general community members find that to be maybe one of the bigger issues, is how do I just learn about? So that became part of one of our goals, because we want to make sure community members know about that, so when you need it, you already are aware of it, not trying to learn about it for the first time. And the second answer there is having access or knowing about crisis services, which I think is also interesting because it might be counterintuitive at first, but if you think about what a lot of people's entry into the system is through crisis. And if you're aware of the fact that that could happen in your family, but you don't already know what to do when that happens, it's kind of scary, because when it happens, you don't have a lot of time to think about it or find the information. You already kind of need to know what to do. So as I mentioned, those were we looked at other community research, of course, but those were critical elements of what informed the strategic goals. And so the first goal is really about filling those program gaps around the community support system, identifying what's missing, where are the gaps in care, and making sure that there's, whether it's hours of service or just the provision of service, that those gaps are getting filled. And that resulted in what really is the majority of the Mental Health Board's funding, which is $60 million over 3 years to 38 organizations to do these core programs. And you see the organizations on the left and how much they get over a 3-year grant. And then you see that connected to the service type that they're doing and kind of how much that totals up to for each one of those components of the community support system, how much funding kind of goes into that bucket, so to speak. And then what we've done on the evaluation side for that is created a data dashboard that tracks not only the numbers served for each of those organizations, also the demographic characteristics of the people being served to ensure that all of Winnebago County is getting these services. So we track it by zip code, race, gender, ethnicity, among other characteristics. You can see that in aggregate for a program year or quarter, or you can even break it down to each individual organization. And the organizations also each are required by contract to collect, to track outcomes based on their goals, and there's about 280 in total across the 38 programs. So that'd be a lot of information for any reviewer to look at. So what we did is we categorized them into 12 domains of kind of common themes, and then we created a way of tracking the progress over those 12 domains. So we're looking at, just for example, access and wait times. So there might be 20 some odd outcomes over these 38 programs that are really focused on access and wait times. And then you can look at that, and if you, it's meant to be interactive, so you can play around with it. You can look it up by each program, or you can look at it in aggregate for those various impacts. The first 3 years of funding, the board solely focused on those core programs. Many of them were renewed and some new ones were funded for an additional 3 years. But the other thing the board really started looking at is what are the systemic issues, what are the things that happen outside of the services themselves that create barriers to getting the services. And so a couple of things that have happened there, if you remember back to the community feedback, more providers and less wait times was a big one, and I think that's interconnected because more providers should lead to less wait times, but more providers also means more workforce. And the board had a little bit of surplus funding after their first 3 years of grants, so they took $10 million of what they had as surplus after that and invested it just into one-time projects that tried to increase system capacity either through an infrastructure project or some other type of capacity building project. And the highest award there, I can't remember, I should have counted them before, I think there were 14 in total, so the average award I think was about just over 500,000. Actually, there might have been 16. And the University of College of Medicine had the highest award for $2 million. And that really gets to the core of the more providers issue, because what that program is doing is a partnership between Rock Valley College, Rockford University, and the College of Medicine to build a college and career pipeline for social work, in which starts through connecting high school students through either an associate's degree or 4-year degree, and then into a master's degree if they want to continue that far along. And really cool update on that is Rockford University just came and gave a public comment to the Mental Health Board at their last board meeting, and they now have an accredited Bachelor's of Social Work program being offered on site in Rockford. and they have 17 students enrolled in that program for the fall semester this year, and many of them are receiving tuition assistance and wraparound supports through this grant. So they have to continue the success of that program to keep or finalize that accreditation. They're in the early parts of that process, but at least in my entire time living in Rockford, I don't think there's ever been a Bachelor's of Social Work program here in our community, and I think that's really important to this workforce issue, and then kind of streamlines the master's degree process for those that want to go further and get that master's degree in social work and become clinicians in the workforce or administrators in the workforce for mental health. Another one that we looked at, and this was not done through grants, this was done through open requests for proposals, was looking at transportation. When the Mental Health Board goes out and does site visits, one of the number one things we hear about barriers programs have is transportation. And so we looked at what other mental health boards were doing, and we put out a request for proposals for a HIPAA-compliant rideshare vendor, and Kaizen Health was willing to work with us, and they are able to essentially create a user platform for any of the funded organizations that want to opt in, where their clinicians can, based on when an appointment is scheduled, schedule an Uber or a Lyft or a medical non-emergency transportation if that's what's required for accessibility issues or otherwise, and get that kind of curb-to-curb or door-to-door transportation to the mental health appointment and then back home. So we're in the early stages of that. We're 2 months in. Show you a little bit of the data we have on that. We're seeing a lot of youth services utilizing that, which kind of makes sense. Maybe not what I would have thought initially, but happy to see that. And then also mental health treatment is the primary appointment type, but also peer support. And I think that's when we think about the lived experience input and through that community survey, that was like the number 2 thing that they really needed help getting access to. So we included that as one of the options for transportation, that it could be for peer support appointments or groups as well. And then lastly, just thinking about whether it's, as a general community member or other, how do we promote, how do we make sure people are aware of the services that are available? Number one thing from the community response, learning more about services. We created a page through our Social Pinpoint community engagement platform that has all of the funded programs along with their program descriptions, but also a point of contact for how you get into the program if you're looking for program entrance requirements or looking to schedule an assessment. That's all there. It's mobile friendly, and it's has translation functions for, I believe, 10 or more of the top utilized languages in Winnebago County. So that makes it even more accessible for people that are having a hard time finding services just because they don't even have the ability to read the information that's being given to them about the services. So you can get that on your phone even just by clicking on that QR code, or it's also available as a website. Also on that page are the new videos that have been recorded by each program for the last program year. Every year they do a video to talk about the kind of stories and impacts that they've had, and all of those go into one playlist on the board's YouTube page, and those just got published like 2 weeks ago. So if you want to learn more about the programs, I'd really encourage going to this page and hearing from the programs themselves about what they think the impacts are. Okay, I'm going to pause for a second. All right. I think you all got this information ahead of time. Apologies for the weird font thing here. I'm not sure how we used a different font here than the other ones. But we did, and so it looks a little goofy, but I think you had a handout, I believe, that maybe came out ahead of time because the deadline for this is tomorrow, and I didn't want to come and present about it tonight. If one of you knew somebody and like, hey, I want to pass this information along, feel like maybe we told you a little too late. So grassroots funding when you think about that one visual with all the organizations that are getting funding, there are a few smaller nonprofits in that grouping, but a lot of them are bigger nonprofits or departments of government. And I think smaller nonprofits, some of the feedback we hear sometimes is they can feel intimidated by competing with bigger organizations in the same funding cycle. The applications can be long and feel intimidating. Maybe they don't feel like they have the dedicated grant writing resources that larger organizations have. And then sometimes even if they get the grant, they feel like the reporting requirements are excessive for a $50,000 grant, and it's the same reporting requirement for somebody that's getting $1 million grant. So the board has taken that feedback and developed a funding opportunity that's targeted specifically for smaller nonprofits, and also looking to touch parts of the community that may be underserved, and looking to either connect mental health resources to people or connecting people to mental health resources and treatment. So that's kind of the main point of it. There's $2 million available for the next 2 years, so that could be up to 10 awards, up to $100,000 each for each year. Letters of interest are due tomorrow by 5 p.m., and then that will lead to a board review, and then invitations will be made to those organizations that the proposal seems to align with the criteria well. They will be invited to fill out a full application. And then awards for that will hopefully be made by March. So a little bit more information on that. The QR code should still work. So if you do want to review any more details, if you're passing that information along to a community partner that you think should be aware of it, letters of intent are not long. They're short, so there's still time to do it. If anyone's thinking, oh, is it too late? It's not too late. Get in the portal tomorrow and just pitch the idea and let the board review it, and then hopefully have an opportunity to file a full application. And that's kind of it. I know it's a lot of information, so I'll definitely stop and let everyone digest that and ask some questions if you have. This is just the place to find all the extra information if you want to go further into anything we talked about.
Thanks, Jason. Commissioners, any questions? Remember, pull your microphones close to you so we can pick it up for the folks that are not here.
Jason, I'd actually like to know what an example of what one of these innovative grassroots funding proposals would look like. I mean, without giving out the confidentiality ones that you've maybe already received. I just would kind of like to know what that might look like, and maybe how you're going to measure it.
Yeah. So we find that innovation comes from the people doing the work, right? So like they know what the innovations need to be. So every time we go through a grant cycle, we get ideas that weren't predicted, and so it's hard to say so maybe come back and do a report once they're funded and let you know what those are in terms of the type of idea that could be anticipated would be maybe you're not a direct service mental health provider, but you're working with a population in a community-based setting, whether it's a community, community center or something like that, and you have the youth there on site, and the youth have the needs, but they're not getting to the appointments, and maybe contract with a clinical mental health provider who brings the services there to the site. That would be an example of bringing mental health services where people are through a partnership that maybe otherwise they're just not getting that connection.
I have a simple question because I missed it when you said it. Which institution offers the Bachelor in Social Work?
So that is Rockford University.
Rockford University,
Yep.
Thank you.
I do have one question. I know OSF just lost some of their funds. Do you know who's absorbing that? They were grant funded and they had something to do with mental health. Do you know who's absorbing those clients or where they're
I don't.
going? Okay.
No. Sorry.
I just have one question. I think that's great that BSW program is starting. That's wonderful to have that happen right in the community. Is there a way to also then address the shortage of psychiatric providers?
That's the board's hope, yes. So in the strategic plan, they identified 3 career pathways. This was done through convening clinical directors of services and college and university curriculum leads, essentially, or deans of schools, and saying, what is your ideal resume that you need as the clinical director? And do you over here at the college and university level provide that degree? And I think where we found the gaps and maybe the points of opportunity that the board then codified into the strategic plan was prescribing pathways. So whether it's physicians or nurse practitioners, those that can actually prescribe psychotropic medications, social workers, and peer recovery support specialists. We're fortunate to get that proposal through the Accelerator Award program to build the social work pipeline and get that started. That didn't happen in a natural way with the other 2, so there might have to be more board proactive engagement to try to develop those other 2 pipelines.
What do we know about why young people are not going into social work? I think the BSM, BSW rather, program is great, but young people really are saying they don't want, some of them are saying they don't want to enter this field. That could be turning around, but what do you know about that?
Well,
Why?
I think maybe when the Bureau of Labor Statistics started showing everybody how much each field gets paid, and you go and look and you say, hey, I'm going to be $50,000 in debt with a master's degree, and I'm going to get $45,000 in pay, and then fill in the blank with, the variety of other options that are out there, whether it's, some of the careers that are in tech that have taken off and that pay level versus education. I think there's just a mismatch between the investment and the return on investment. And I think, one of the things that helps is having a local fund. I think we have heard anecdotally, while we haven't done a study on it, that wages have gone up. Some of that's just the competitiveness of more local funds means providers try to retain their staff or they'll jump to another place, so it kind of naturally increases funding. But a lot of it's influenced by Medicaid reimbursement rates as well, because organizations often are also billing Medicaid for some of their services. But I think, so part of it, local funds, I think does create higher wages, but the other thing is then maybe reducing some of that debt for the student coming out and providing more tuition assistance and wraparound supports while they're going through it from the first half of it.
Well, I also think we have a program at Auburn High School now which focuses on social work. We went through on the regrow grants. I think that like anything else, you got to build your farm club. So if we can get into the high schools with some sort of program and give these kids an education as to what positive elements there are to a future and this type of care is kind of an important thing to look at.
Yeah.
I think you might have mentioned it earlier, but is there a fee to use the transportation service? And is it just within the city, or is it?
There's a fee that gets charged to the mental health board, but there's not a fee to the person or the agency.
And Jason, that covers all of Winnebago County?
All of Winnebago County, so the ride has to originate and end in Winnebago County. So, the residency needs to be in Winnebago County and the service needs to be in Winnebago County. And right now it's a pilot for the funded programs through the mental health board. Depending on what we learn from that, there's a possibility of expansion beyond that, but that's for this current year, who's eligible to use that service.
Do telehealth services qualify under any of the grants, or because I don't know if perhaps getting offering help getting there, right, with rideshare and that, but maybe there are more people who, and more providers who would be willing through telehealth. I don't know.
Yeah, it's not restricted, and I think more providers are providing that. Most of the psychiatric services in town, at least through community mental health organizations, are telehealth. It's just a reality of the situation with psychiatrists right now. So some of the mental health board funding has been used, particularly with Crusader, Community Health, and Rosecrans, to expand telehealth psychiatric services. And at the clinical level, at the clinician level, so for the psychiatric services, usually you still have to go to the site of the medical clinic, but then you're accessing, because you do the nurse part there, you might do blood pressure and things there, but then you're still having the psychiatric appointment, telehealth, but you're on site. Some of the clinical services can be offered, like counseling can be offered through telehealth, where it's not, where you're actually at home doing the counseling service. And actually, Family Peace Center, through a grant through the Mental Health Board, just contracted with a telehealth provider to offer that service for their survivors that have trauma when they can't make it to the Family Peace Center for counseling.
So what happens if that client doesn't have access to the internet or a device or something like that? Is there anything built in there that...
This is where we start to get into all the social determinants of health, broadband access and all those other things. I think the Mental Health Board tries to take the most holistic approach they possibly can while staying within the guidelines of the statute. So, can't get into community-wide broadband access, but trying to do the best to at least address whatever core systems issues you can that connect to services. But yeah, there's a whole host of other issues that affect access to care like that, like internet access.
Jason, you probably said this earlier, and I'm sorry I didn't track on it. What percentage, again, of people with mental illness have a co-occurring disorder, such as substance abuse?
Oh, you caught me on that one. I don't know the number.
It's high, right?
Yeah, it is high.
75%.
It is definitely high, and I don't want to make up a number, and
Okay.
I don't have it in front of me.
Okay.
Any other questions from the commissioners?
I'm sorry, I have one more question. Yeah, I have lots of questions. So the Kaizen Health, are they like an intermediary between the mental health board and the clients? Do they administer this ride share program? How does that work?
They're more of an intermediary between the mental health board and the ride share provider, like the actual transport. They do set up an account for each of the providers, but we basically authorize who, if they want to add a user, they have to go through us, and then we tell Kaizen, you can add this user. So I guess in the ecosystem of it, it's like there's the board, and then we kind of being the administrative arm for the board on that. There's the organization, there's the client, and then there's the actual transportation company, whether that's Uber, Lyft. And so I don't know who's all the, we're all kind of interconnected in that system.
Are they just regular Uber or Lyft drivers? Is there any additional?
They utilize the Uber Health platform through Uber. The way that they're set up is that the person will get like an address to pick up, and I think they get just like the first name or something, and then they have their own platform that's outside of it that gives a text message to the person. It's really nice, sophisticated system. McHenry County Mental Health Board's been using it for several years, and they had nothing but great things to say about it, and just really protects the privacy of the person and offers a variety of transportation options, so it can be really tailored to the needs of the person, whether it's curb to curb, or maybe it needs to be door to door in some cases.
And it can be a minor?
Yeah, I'm not sure what each agency's policy is on that, because I think in the mental health world, I think the age of independence, so to speak, for treatment is like age 12 in the state of Illinois. So I'm not sure what all of those each organization has its own kind of internal policy for how they're managing that with their clients and client consent. But the platform allows for the agency to make that determination.
Jason, I imagine with the transportation, so these are folks' personal cars, right? Just like an Uber.
Yeah.
If you had someone who has like an accessibility need, you all are working with another provider. You're not necessarily going through this service.
So they would go through the service, but they can use the non-emergency medical transport companies as well. And we're seeing that that is being utilized. One of the organizations that's using this service is the Lifescape for their senior mental health program. And they're not only, but like some of their transports have been non-emergency medical transportation that can have the accessibility features that are needed within the vehicle.
That's good to know. Awesome. Okay. Any other questions from the commissioners? Anything from city staff? No? All right. Thank you, Jason.
Thank you.
Thank you.
All right, commissioners, the next thing on our agenda is commissioners' reports. So does anyone have something they would like to share?
I don't have a report, but I did want to talk about as we move forward to talk, and I guess, Eric, me and you have been on the longest, to see of how we can look at, we've listened to so many people coming in, to see what our next plan of action is, to be able to give the mayor more plan of action. I think we've had a lot of listening ears, but to see how we can maybe start with a plan of action. So I just wanted to kind of put that out today to see what we could do to be able to move forward.
Thank you. Any other commissioners' reports? Anything from the city? All right. Well, that will be a fairly quick meeting tonight then. I will take a motion to adjourn.
I motion.
Second?
I have a motion and a second. All in favor of adjourning our meeting, say aye.
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 Any opposed? See you next month.
All right.